I'm David Klein, an emergency physician and an editor for Tintinelli's Emergency Medicine. Needle cricothyrotomy should be considered for children when oral tracheal intubation has failed. It is generally regarded as the only surgical airway technique for infants and children. Alternatively, it can be used in adolescents and adults for a period of 10 to 15 minutes when other emergency airway techniques have failed and preparations are being made for a more definitive airway.
Use sterile gloves as part of standard personal protective equipment used for all open procedures. Equipment required for this procedure are shown here: a 14 or 12 gauge sheathed needle catheter, a small syringe, an adapter from the end of a number 3 endotracheal tube, an oxygen source capable of delivering 50 psi connected by tubing with a Y connector or fastened with a side hole as shown here, a jet injector, and tubing for connecting to a regulated high-pressure oxygen source. A bag valve mask can be substituted, but this is not optimal. The physician, at the level of the patient's head, starts by locating the cricoid ring. Place the index finger at the sternal notch and palpate cephalad until the first rigid structure is felt. This is the cricoid ring. Roll the finger 1 finger breadth above to locate the hollow between the cricoid and the thyroid cartilages. This is the cricoid thyroid membrane and the site for needle insertion. Attach the syringe to the catheter. Introduce the catheter into the subcutaneous tissue at a 90-degree angle to the skin. Aspirate gently while advancing the catheter. When air suddenly returns, indicating entry into the airway, change the angle to 45 degrees and advance the catheter over the needle into the larynx. Withdraw the needle and the syringe. Seen again from a higher perspective, the procedure is repeated. Aspirate gently while advancing the catheter. When air suddenly returns, indicating entry into the airway, change the angle to 45 degrees and advance the catheter over the needle into the larynx. Withdraw the needle and the syringe. Attach the oxygen source to the adapter and start ventilation with 100% oxygen. Intermittent jet insufflation at 50 psi can be achieved by occluding the Y connector or side hole in the connecting tubing. Insufflate for 1 second and then release the occlusion for 4 seconds. To achieve the required high pressures, it is best to use a jet injector regulated by a flow meter attached to a wall unit or a tank. A regulated injector is preferred to an unregulated wall unit or tank. The physician must hold the catheter securely as it can become displaced with minimal movement. The inspiration to expiration ratio may need to be 1 to 10 to 1 to 15 to allow for expiration.
Needle cricothyrotomy does not provide for adequate ventilation and should be regarded as a temporizing procedure until a more definitive airway can be established.